Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, starvation in Gaza. Dr. Paul Spiegel is the director of the Center for Humanitarian Health at the Johns Hopkins Bloomberg School of Public Health. He speaks to Dr. Josh Sharfstein about the dire situation in Gaza, challenges with the implementation of a privatized system of food delivery, and recent changes to allow international organizations to bring in more food. Let's listen.
Dr. Paul Spiegel, thank you so much for joining me today on Public Health on Call. How are you doing?
I'm doing okay, Josh, given these circumstances, and thank you for having me.
Well, we'll get to some of those circumstances, but talk to me about the big picture. You've been at Humanitarian Health for a long time. What is the landscape right now?
I've been working in this field for well over 30 years now, and I think none of us have ever really seen a landscape like this, where it's not just that we are not able to respond according to the numbers of emergencies, the number of people that need our support, but the actual system itself is in crisis right now in terms of a dramatic lack of funding, but also the foundations of humanitarian health in terms of respecting humanity, following international law and humanitarian principles are all at threat. And so we are all being threatened. And so I don't think any of us have really experienced a situation that we are in right now.
I want to focus in on one of the parts of the overall situation, which is in Gaza. The last time you came onto the podcast, we talked about the fact that the approach to humanitarian assistance in Gaza was changing from an approach that relied on the United Nations and non-governmental organizations or NGOs to a very different way of distributing food and other essential supplies. Could you just refresh everyone's memory about what that change was about?
Yeah, so Israel, supported by the U.S., has created something called the Gaza Humanitarian Foundation, or GHF. And basically it's a way to securitize or militarize humanitarian assistance, particularly food assistance. And the Israelis say they've rationalized this to say that this is the only way to stop Hamas from taking the food. And so what they've done is, as opposed to in the past where there are well over 400 sites and the UN and the international NGOs and the national NGOs provide food to all persons very close to where they live, there are now, or have been at varied approximately 4 sites, and it's completely militarized where people come in, they have to go through where the IDF is, and they're considered armed combatants, and these people are very scared, so many people won't go through. Then they go into the site itself, and again, it's mostly American ex-military who are handing out these goods, but there is just not enough food. People are starving, so there are riots. People are actually being shot and killed while trying to get food assistance. And this was quite predictable because of the way this was designed. And it was designed to bypass the UN and the international NGOs. It would never work. And the results are, unfortunately, that many more people, up to maybe 1,000 people, have been killed trying just to get food assistance.
When we talked last, you had a pretty strong opinion that this wasn't going to work. And you had told me that it was violating certain principles of how humanitarian aid should be distributed. Talk about those principles.
The 4 humanitarian principles of humanity, impartiality, independence, and neutrality. None of these really are being respected in the way this food has been delivered. If you have an occupying force that is surrounding the food distribution center, it can't be impartial. Many people are not going to be able to go, and certainly certain people, if they try to go, may get arrested. Secondly, this site cannot be, and this group that is handing out the food cannot be neutral because they have the IDF surrounding them and providing food. And nor can they be independent. And then on top of that, there are not just the principles, but there are the accepted ways to provide food. And that is to make sure that all people can get food, whether you're vulnerable. You need to be able to get food to these people, not just have people walk tens of kilometers to get a very, very heavy parcel. Who's going to get that? It's going to be young men, and they're going to be fighting, and there's certainly not going to be equity within food distribution.
Can you give me an example of a different way of providing food?
Certainly. When the Taliban took over a couple of years back, I went to Afghanistan to work with the World Health Organization, and there we worked with other UN agencies to be able to provide food, particularly in some of the health centers. So in those situations, what you do is you try to get the food as close to the people that needed it. And so you have numerous different sites. You ensure that there is access, there's good communication of where people need to go to. In our case, when we were looking at trying to get food into the hospitals and into some of the primary healthcare centers, you're working with the communities and you're making it as easy as possible for them to be able to get food. So it's a completely different open system where it's not as if people are coming to you, but rather you're going to them to provide the food that they need.
What have been the consequences of this new approach in Gaza? You talked about people getting killed on the way to getting food, but we've also been seeing headlines about famine.
For a long time now, there has been insufficient food being allowed into Gaza. It's been happening now in such a severe way that we are seeing people die of famine. And this does happen in other situations. It's also currently happening in Sudan now as we speak. But this is unacceptable because the food does exist, the systems exist, and this should not happen. And the knock-on effects are very, very serious in terms of people that are already suffering from lack of food.
Talk to me concretely about what this looks like for people living in Gaza.
It's hard to even describe, but what it looks like is you aren't able to get enough food to feed yourself and your children. And so most people are living on less than one meal a day and some no meals a day for days on end. It's so bad that the distribution and the diversity of food is completely inadequate. People are not able to get enough food. You need micronutrients as well as macronutrients to be able to grow, but also to be able to ward off infections. So some of the latest study that just came out in Gaza City is that 1 in 5 or 20% of children under 5 years are acutely malnourished, which is levels that are unheard of in Gaza. We have seen this in other places, but not in Gaza. And we've been seeing now children and some adults dying of starvation in hospitals, but we're also seeing other deaths that should not occur because when you are so malnourished, you can't fight off other infections in the same way. It takes, when you need to heal, it takes more calories. And so the knock-on effects of being malnourished in terms of dying from other diseases, one doesn't die generally from being malnourished, but from other diseases that cannot be fought because the body is so ravaged.
Besides children who are suffering in tremendous numbers, as you mentioned, are there any other populations that you're tracking?
Across the board. So we often see different coping mechanisms. So in this culture and many other cultures, adults and the elderly will try to give as much of the food as they can to the children. So we're seeing dramatic weight loss in amongst adults and amongst the elderly. We're even seeing some issues that I wouldn't have thought would have happened. And so I was speaking to someone who's on the ground there, and there is a lack of insulin, and so for type 1 diabetes. But, he was saying one of the big problems is not just the lack of insulin, but there actually is no sugar. So people are, when they're being hypoglycemic, not enough sugar in their body, there is no sugar to be found to be to bring their blood glucose level up. It's that bad that basic commodities are missing.
Right. And there's a risk of death in that situation.
Absolutely. Absolutely.
Thank you for that explanation. Now, this is a very divisive political conflict. And one question that people may have is who's responsible for that famine? Because, and I've certainly seen people making this argument, if Hamas were to release the hostages and step back from power, then more food could come in. So I wonder, in these circumstances, how does Humanitarian Health think about the responsibility to provide food?
Yeah, thank you for that question. Maybe just to step back, because we don't often get the opportunity to discuss in this amount of detail. If we go back to October 7th, I think it has to be very clear that Hamas was completely responsible for what happened. Hamas is a terrorist organization, and what they did were crimes against humanity in Israel. And I think there's no question about that. And I think, as many people have suggested, if the next day or if any time Hamas says we will no longer be in power and will give back the hostages, this would be over. But in the humanitarian setting, and since clearly this isn't the case right now, and regardless, we always need to protect civilians in all situations. And that's what international humanitarian law does. It looks at different situations and ensures that while there is a war, it ensures that civilians and unarmed combatants are protected. And that means that warring parties, those occupying powers, must provide sufficient food, sufficient health care to ensure that civilians are able to survive during these incredibly difficult times.
So in essence, are you saying that the obligation is with the occupying power regardless of the political circumstances?
Yes. Bottom line is yes. It is that power that is responsible to protect civilians, as they are the ones currently in power in that area.
It also then the case that it is not permitted in humanitarian law to deprive a population of food in order to gain a political advantage.
Again, yes, that is the situation. International humanitarian law doesn't exist to stop wars, but rather to set rules for how they are fought. Rules that aim to protect civilians and others not involved in the fighting. Its purpose is really to reduce suffering during war by ensuring that even in the midst of conflict, people are treated with dignity, and that the most vulnerable are shielded from the worst impacts.
So, Dr. Spiegel, applying those principles in this situation, what are the obligations under international law that Israel has?
So Israel must be able to protect civilians in these circumstances. And that means that they must be able to ensure, as the occupying power at this point, to be able to ensure that there is sufficient food, that there is sufficient water, medicines, healthcare for these people to survive, and not to be able to put people under a siege, for example, or to limit the amount of food that is able to get into a territory in order to put pressure on their other warring parties.
Now, Dr. Spiegel, there have been some developments in this story in the last day, even in the last few hours before we started recording. Can you tell me about those?
Certainly, Josh. So there's been two, I would say, major developments. One is that the New York Times has reported that the IDF, the Israeli military, had told the Israeli government that there was no evidence that Hamas had been systematically stealing or diverting food. And many of us, we've been able to do studies and follow the amount of food that was getting in and distributed. We knew this to be the case.
So are you saying that the justification for all of these changes has really been put into question by the Israeli army itself?
Yes. And, I think many of us knew that the main reason this was occurring was not because of the diversion of goods, but rather to bypass the UN Relief and Works Agency, the World Food Program, and other organizations, so that there would be the implementation of this militarization of food assistance that the IDF, the Israeli Defense Forces, actually controlled, and not the UN and the international NGOs.
What was the second major development?
Second major development is positive news, is that it's being reported that Israel now has agreed to develop humanitarian corridors to allow the UN and the NGOs to deliver food. This is quite important. I should say that they previously did allow airdrops by some governments, but airdrops are just a drop in the bucket, and it's more for media. They really do not have much of an effect. But having these humanitarian corridors where apparently some of the Israelis have agreed that they will stop bombing in certain areas to allow the UN and the international and national NGOs to deliver food is, I think, a very important development. And it does show, again, that the UN and the international NGOs can do this when there is security for them to be able to do so.
What do you think has led to that change?
I believe that there is enough evidence to show that everyone that has been speaking out, but everyone from whether it be us, whether it be those in Gaza, the media showing what is happening has really made a difference, number one. But number two is, besides the US that clearly has the most influence over Israel, many governments, the European governments within the European Union, the UK, Australia, have also been forcibly speaking out, particularly over the last week when we've been seeing all these images of people, children dying of starvation.
What are you going to be looking for to see whether there's real progress being made in delivering needed food to so many people who are starving?
The good thing is it will be easy to measure, because we will be able to, particularly if the international community is delivering this food, because we'll be able to know how much food is delivered and where, number one. Number two is, it can't be just food. It needs to be fuel. It needs to be water, and it needs to be medicines and nutritional supplements, ready-to-use foods, because we're already on such a slippery slope of famine and people are dying. So I still expect there will be deaths due to famine, due to infections, due to lack of food. But I'm hopeful that we're going to see now big changes. One of the questions remains, however, how long will this happen? This has happened before, and then Israel has stopped food being allowed to come in. And it's always a bit of, okay, let's open it up, and then it stops, and then there's more suffering. And so I'm hoping all governments will really push Israel to allow civilians to receive sufficient food, fuel, water, and medications, as is their obligation as an occupying power.
This is a rapidly changing situation with an awful lot on the line. I can understand why at the beginning of this conversation, you said that you are only doing okay. Given the situation in Gaza and the loss of funding and structure for humanitarian health around the world, what are your thoughts about the future of the humanitarian system?
Well, I think we've known for a long time that the humanitarian system needs to be reformed, but there's been a reluctance to reform, because sometimes you need a catastrophe or crisis to really have reform. And I do think we're at that situation now where, since February, there's been a dramatic reduction in funding and political will. And as I said at the beginning, I think the humanitarian system needs not just a reset, it needs a real transformation. And perhaps we're at the stage now where that can happen. And for me, that would mean, and we're working on it with the Center for Humanitarian Health Lancet Commission, we're working on this with a group of people across the world. But what it would really mean would be a reset of power towards affected populations and the national authorities and national NGOs. It would mean funding going to them and not to international agencies. And it would mean real accountability. So when people break international humanitarian law, or when they're not using the funding in a cost-effective way to help people, they're held to account. I hope that real change will occur, finally, as we've been calling for it to occur for a long time now.
Dr. Paul Spiegel, thank you so much for joining me.
Thank you. Thank you very much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.